Good afternoon, everyone. This is Ken Bradford with the Department of Education. We will go ahead and we will begin our Zoom webinar this afternoon on school operations and reopening updates.
All right, I'm listening. Y'all can talk though. They can't hear me.
We will make sure everyone is on mute. Yep, so a couple of housekeeping notes before we begin, just to let you know how the slide presentation will be presented. Superintendent Brumley will go through a series of slides, providing you the most recent updates, programmatic and policy related. And then we will also, what's new on this presentation today is we'll have a series of slides towards the end on some waivers relative to food and nutrition that will be presented and shared. Following that, we will go into a question and answer session. We have Dr. Welch from the Office of Public Health who is joining us today, who will answer questions. I just say today during the webinar, as you get questions, please send them through the chat feature. I will be grouping those like questions during the webinar, and then when we get to our question and answer session, I will be posing those to Dr. Welch and or Dr. Brumley. So at this time, what I will do is I will turn it over to Dr. Brumley, who will begin this afternoon's presentation.
Thank you, Mr. Bradford, for that introduction. And I would like to thank all of our system and school leaders and educators who have joined this call today to discuss some of the most recent actions that have been taken by Bessie, along with some of the additional tools and resources and guidance that we are putting out here at the department. I have been so impressed in conversations with so many of you all about the way that you are approaching finding a way to educate students during this global health pandemic. And I think it's so important that while we focus on providing safety and providing a safe work environment for our employees, that we do find a way to educate our kids. And I believe that we will see so many innovations that happen over the course of this year that will shape education in the years to come, even once we get a vaccine for this terrible virus. So just briefly, I'd like to introduce the reason for the minimum standards set forth by Bessie, and they're a result of the 2021 Extraordinary Session, Act 9. Act 9 began in the legislature as HB 59 and then was ultimately signed into law as Act 9. Pursuant to Act 9 of the 2021 Extraordinary Legislative Session, the State Board of Elementary and Secondary Education adopted emergency rules informed by the Centers for Disease Control and Prevention guidelines to provide minimum standards, policies, medical exceptions, and regulations to govern the reopening of schools for the 2020-2021 school year to ensure that students, faculty, staff, and others on school property are protected to the extent possible and practical from COVID-19. So Bessie came together and heard recommendations from the department on Tuesday and unanimously approved minimum standards for school systems to open. Now, the next step that has to happen, all local school systems prior to the beginning of the 2020-2021 school year, each non-public charter and public school governing authority must adopt policies, rules, and regulations in accordance with the rules and regulations adopted by Bessie. So Bessie set minimum standards working alongside the Department of Health and other agencies. And now local systems, non-public, charter, and public have to adopt policies, rules, and regulations that are consistent with those Bessie minimum standards. Talk through our resource development process. So the Department of Education, we have worked alongside the Department of Health. I believe Dr. Welch is on the call today over the past month to develop public health guidelines and best practices to support school reopening for the upcoming year. This included consultation with the following: the Southern Regional Educational Board's Reopening Task Force, Superintendent's Advisory Group, the Public Health Response Team, the Resilient Louisiana Commission's K-12 subgroup, the National Governors Association, the Resilient Louisiana Commission's Education and Workforce Development Task Force, and full RLC adoption. We also worked alongside some of the best experts in the virus within the state of Louisiana and worked hand in hand with these individuals from Ochsner, Children's Hospital of New Orleans, and Tulane Medical Center. Reopening resources. So we're providing guidelines which are baseline public health requirements for school systems to follow when reopening school facilities to students in fall of 2020, providing best practices, supportive guidance and resources for implementing guidelines, a planning template and checklist, which is a template with questions to guide school systems in planning for reopening with an accompanying checklist for reopening, an FAQ document. LDOE released and is maintaining a dynamic FAQ document for implementation support. So this FAQ document will be inclusive of the questions that are most frequently asked from the field, and we will maintain that and update that as time goes by. And finally, a self-monitoring checklist, school system checklist to ensure BESI adopted requirements are being met. This tool will be available the week of July 20th. So this checklist will be for self-monitoring within your system. Reopening instructional resources, our teaching and learning toolkit. We have recently updated the Strong Start guidance that we have available online. We are trying to add things that we feel might be important to leaders and educators as they work through the school year. So you will continue to see that document be updated, and we're very focused on making sure that to all extents possible, we're providing you the support that you need and within the limits of what we're able to provide. But this toolkit supports school leaders and teachers. It includes high-level actions to implement the priority along with samples and models for implementation. It is structured around implementing the following teaching and learning priorities: assessments and individual student plans, continuous core, non-core, and CTE instruction, student and staff well-being, professional development, adaptive and flexible staffing plans and schedules, strategic communication plans, and one-to-one device and access. So the LDOE's best practices that you'll find in Strong Start include supportive guidance and resources for implementing our standards in conjunction with LDH. Those include specific strategies for physical distancing and facility use, including entry and exit procedures, how to safely monitor symptoms among students and staff, and how to respond to symptomatic individuals, personal hygiene and cleaning protocols, including the use of face coverings, food preparation and meal service guidance, transportation safety, hygiene, and cleaning guidance and references, and multiple reopening scenarios, such as what will your hybrid model for education be, and what will be your model if you're fully remote, fully distance learning. And as a reminder here, we've asked every school system in the state to build out an online learning platform for families who do not feel comfortable sending their students back to a brick and mortar facility. We have support from a number of key partners. We are again highlighting this set of partnerships, not that this is inclusive of all the help that we're receiving, but we do want to point these out. Children's Hospital of New Orleans hotline for school wellness and virtual care. You have the number there, offers guidance to school nurses and school administrators. Children's Hospital of New Orleans Town Hall series for schools is being conducted every 2 weeks through July and August, and that next town hall, mark it down, July 21st at 1 p.m. We have regional public health officers who are able to provide one-on-one consultation to school system leaders with public health operational questions. We'll share out that we are working even still with LDH to try to provide help and assistance on some of the most frequently asked questions and scenarios that we are hearing from the school systems. Here is a support from a key partner, and this will be the first time we are sharing this information, but we're really excited about being able to offer this support. It's around PPE, personal protective equipment. As school systems plan for operations during the upcoming year, the department is working in concert with the Governor's Office of Homeland Security and Emergency Management to address immediate personal protective equipment PPE needs. So that agency is going to provide at least one cloth mask for each student and faculty member, at least 2,000 disposable masks for visitors and or students, faculty that may have forgot their mask, and at least 3 thermometers per each school. So that's a relatively large announcement that we are making today that we find to be significant. While school systems are, obviously having to secure PPE, and I know many of our systems are using CARES money along with other general fund dollars that they have. We hope that this will go towards helping you fill in the gaps by making sure that you have at least one cloth face covering for every student and faculty member, an additional 2,000 for standby, and 3 thermometers for every school. School systems should make the PPE request directly to the parish office of Homeland Security and Emergency Preparedness, those directors in respective school systems, by following the steps below. 1, school systems should compile data that depicts the number of students, number of faculty members, and number of schools. Each school system will make requests to the respective parish office based on data specified in the number 1, the above bullet. Requests should go to the local contact, and then delivery will be made to the school system's warehouse for school distributions, as systems already have a mechanism to disseminate their own supplies. And be sure and take this website down there. If you have questions, shoot an email to that email address, not website, I'm sorry. Shoot an email to that email address, and we'll respond with any information that you might need. We're also opening up office hours to help support you and the decisions that you need to make. Strong Start school reopening office hours will occur each Thursday, beginning July 23rd, from 3 to 4 p.m. and run through September 3rd. You have information there on how to access those office hours. You also have phone numbers, meeting ID, and passwords available for you. Now let's take a look at our reopening requirements. The first minimum standard, and these requirements have been placed into bulletins for traditional public systems, as well as public charters, as well as non-public. So this is applicable to all the schools in the state of Louisiana. The maximum group size that may convene indoors in a single room, irrespective of room size, or outdoors at any given time, are as follows. So if we are in phase 1, that's 10 individuals in a room. So you have to account for your teacher, your paraprofessionals, anyone else who might be in that room. So the easiest way to think of phase 1, 10 individuals, would be 9 students and a teacher. We're presently in phase 2. In phase 2, that number is 25, so that could be 24 students and the teacher. And of course, you can see a substantial difference between phase 2 and phase 3. Phase 3 moves to 50 individuals. Younger students who are unable to wear face coverings or maintain a physical distance from other students or adults should be assigned into static groups. Static groups are groups of students that stay together for the entire day. They can be considered as a pod, a cohort. I would strongly suggest, to all extents possible, maintaining static groups, at least in your elementary settings. We are just saying younger students. You can see the language that we have provided for you, but practically thinking through this with my school principal hat on, I would be trying to make as many of my classrooms as I possibly could static groups, so that I would have those groups together, and I would be able to control my situation a little bit in terms of students intermingling or not intermingling with each other. Now, that may change, and that's allowable to change once you get into students who may need to shift classes. If students have to shift classes, and that's the last sentence, we're asking that we maintain a physical distance of at least 6 feet from other students and adults in a classroom or indoor setting to the greatest extent that you possibly can. So again, Younger students, I would consider, if I were a principal, maintaining those pods, those cohorts, to the greatest extent possible and into as many grades as possible. But that's certainly decisions that you all will have to make on your own. But you do have the freedom with students who do have to intermingle for that to happen, so long as you can create that social distancing. Physical and environmental standards. If a group convenes indoors, it must convene in a room enclosed by a wall or a partition. This includes large rooms such as a gymnasium or auditorium, which may include more than one group, but only if that group is separated by a wall or a partition. If groups convene outdoors, a physical barrier is not required, but each group must remain separated. 3, to the greatest extent possible, schools must limit crowding at entry and exit points and maintain maximum group sizes and physical distance recommendations. 4, if a room is used by more than one group in a single day, high-touch surfaces contained in that room must be cleaned before and after each use. Now, on number one, on that slide, we were asked the questions from some systems, if they have larger rooms, can they use those rooms for multiple classes, multiple groups? And so the answer to that would be yes, but that's only if you're able to put up some form of partition or barrier in between those groups. Then on this slide, number 3, I think about our middle and high schools more than anything else. When those bells would typically ring in a normal year, or you would change classes, students would leave, and they would intermingle. There would be possibly doors where there would be some degree of congestion. And so I know that you are all having to really think through how are you transitioning classes from one place to the next to prevent some of that crowding. And then 4, just having to make sure that those high touch areas in a room are clean before a new set of students come in. So that does not mean you have to go in and do deep cleanings. It doesn't mean you have to disinfect that entire room. It just means those high touch surface areas that they be cleaned before a new group comes in. So, I tend to think of like the surface of a desk, a desktop, probably your doorknobs, those really high touch areas. Okay, monitoring students and adults for symptoms. Each school must establish an area used to isolate anyone showing signs of being sick. Upon arriving at the school facility, each adult and student must be assessed for symptoms of COVID-19 as defined by the CDC, and this does include an initial temperature check. So if you do a temperature check on an individual and they are 100.4 or higher, you know that you need to give them a few minutes, then do another check to see if they still have that fever. We obviously live in Louisiana, and it's not cool in August, and so some of the elevated temperatures may just be because it's hot outside in the environment. So we need to make sure that we give them a cool off period, then check that again. If after that second check they are at that 100.4 or greater, of course they're in that isolation room, but they need to be removed from campus as soon as possible. Environmental cleaning and personal hygiene. High-touch surfaces must be cleaned multiple times per day, including the bathrooms. Students must wash or sanitize hands upon arrival at the school at least every 2 hours, before and after eating, before and after using outdoor play equipment, and before exiting the school facility. Okay, let's talk about face coverings. This is one of the hottest topics throughout our state, and frankly throughout our nation. I have been more convinced than ever before that face coverings do matter, that they do help prevent the spread of this virus. And so I even heard the director of the CDC come out, I believe yesterday, indicating that if everyone were to wear a face covering, we could certainly tame this virus to some degree within 4 to 6 weeks and get it back in check. And so we are certainly encouraging the use of face coverings. We know that it puts many of you in a difficult situation in your local communities where face coverings are not supported. But if we're following the science here, all of the experts that we are dealing with encourage the use of face coverings. So language says, while inside the school facility, all adults, including but not limited to teachers, administration, support staff, and other adults, visitors on campus, and students in grades 3 through 12 must wear a face covering to the greatest extent possible and practical within the local community context. While inside the school facility, students in grades pre-K through 2 may wear a face covering. While inside the school facility, the face covering requirement does not apply for children under 2 years old or individuals with respiratory issues or other disabilities that prevent a face covering. So I want to push in a little bit on this. 3 through 12 must wear a face covering. Now, there is a qualifier at the end that says to the great extent possible and practical within your local community context. We have not sent 800,000 students to school before in a face covering. So we don't know exactly what this might look like. And so due to that, that's why we're saying to the greatest extent possible. This gives system leaders some level of autonomy and flexibility with that implementation. But we also want to be clear that we are saying must wear a face covering in grades 3 through 12. Would also like to point out that HB 59, which is now Act 9, was initially introduced to provide systems liability relief. And as amended, Bessie had to provide minimum standards, and then local systems have to adopt policies that align with the Bessie minimum standards. So I would be comfortable in suggesting that if you're not following the minimum standards set forth by Bessie, then you're probably not going to have as much of the relief in terms of the liability. So we have to make sure if you want relief from the liability that you're following the standards set forth. And that's a good point to make with community members who are questioning your decision making. Medical or disability impact exceptions will be addressed on an individual basis by the school system in accordance with local policies. Hygiene supplies. School employees must be provided with adequate access to hygiene supplies, including soap, hand sanitizer with at least 60% alcohol, disinfectant wipes or spray, paper towels, and tissues. And so one of the reasons face covering should also be provided when they're needed. One of the things that we heard from teachers, teachers who are certainly going to be frontline employees, essential employees, we wanted to make sure that teachers at a minimum had the same level of protection that we see employees in other sectors who are going back to work. And we see individuals in other sectors who have gone back to work. And so we want to make sure that that we have the basic PPE and hygiene supplies that our teachers need in order to enter that workforce. And so that's one of the reasons we included that. I also want to pause here and just encourage systems to think about. I don't know if you recall, but in around March and April, we saw these community efforts, and rightfully so, to honor our medical professionals, our nurses, our doctors, our ambulance drivers who were on those front lines in responding to COVID. I would hope that as we move into the school year, that we can see some of that happening within our local communities as well, where you are partnering maybe with business partners or nonprofits or faith leaders and beginning a campaign that honors our educators as they step into the front line now, as it's their turn to step into these situations, and as we do our part in teaching and learning. So I would encourage that. The other thing I would encourage, specific to employees, because we have a large audience on the call, is engage your employees, engage your educators, get feedback from your educators on their needs. That might be something as simple as a survey It might be open-ended. It might be a Likert scale. I just want to encourage everyone to get feedback from their employees. The other part of that, even beyond surveying or feedback circles, would be communicating with employees. Some of the concerns we hear from educators would be that they don't know what's going on. And I understand that some local systems have been waiting for the BESI standards to come out before they set forth their plans. But I think the more that you can inform your employees about, hey, these are the things that we are doing. These are the ways that we're going to make sure that we're prepared. These are the things that we're doing in terms of professional development or providing online instruction. If you can communicate those things out to your employees, I think that we'll all be better off, and not suggesting in any way that any of you aren't, just reinforcing that is pretty important right now, to make sure you're getting that employee voice, making sure you hear what their concerns are, and making sure you're communicating about your plans. Transportation. School buses used to transport students must not exceed the following maximum capacity requirements. Phase 1, 25%. Phase 2, 50%, and Phase 3, 75% of the school bus manufacturer's capacity. I know that we have different size buses in the state. We have different size buses within the systems and within schools even. So just need to make sure we know the manufacturer's capacity of each bus, and that we're only full to that capacity. Students with disabilities must continue to receive special education and related services in the least restrictive environment. School systems must factor in any additional service providers who may need to enter the classroom. Students who receive services outside the classroom and/or students who receive services through alternate instructional methods. So basically, we have to follow IEPs, and we have to follow FAPE and the LRE. We have to make sure that our students with disabilities are getting what they need. And if you have a requirement of 25 individuals in a classroom, you have to account for, if you have to push in some form of service provider into that classroom, that's going to count in terms of how many individuals are in that classroom with any given time. So be sure that you are thinking through those things. Responding to positive cases, what are the steps when a student in a school tests positive for COVID-19? One, if a school becomes aware of a presumptive positive or positive case of COVID-19, the child should not attend school until determined to be non-infectious by their doctor. Two, parents may be notified by the Office of Public Health if their child may have been exposed to the case of COVID-19, along with any next steps. Three, if it is determined that a school was the focus of infection for COVID-19, the school superintendent or system leader, in consultation with the Office of Public Health, will determine if the school should remain open or closed for a period of time. A positive case of COVID-19 does not necessarily warrant classroom or school closure. So a few points here. On number 3, the last sentence, this is really important, and I had a superintendent today. I had some conversation with the superintendent today, and this superintendent indicated this might be one of the most important things that we need to communicate in our local systems, because we know that COVID is in our community. We know that there's a great likelihood that we are going to have COVID cases in our schools, but a positive COVID case does not necessarily warrant that we shut down a classroom, or certainly that we shut down the school. But I think it's important that we go ahead and begin that messaging process with our employees, with our families, with our communities, that a positive case of COVID does not mean that we close our schools. I am working with LDH, and we are thinking through some of the most common scenarios that we anticipate you having in terms of positive cases, and seeing if it's possible that we might even be able to get out more resources to you over the next few weeks. And as you can see through this presentation, and if you go online to the Strong Start document, you will see that we are building up that site, building up those resources and those tools and building up support such as the mask, the face coverings and the PPE equipment that we shared earlier with the Governor's Office of Homeland Preparedness, but also even things like the office hours. So we will continue to evolve. We'll continue to try and get better and be supportive of the needs that you have. Implementation protocols. So systems must develop a reopening plan that includes the following items. So we need to make sure that your plan for reopening also includes these things. One, what is your plan for distance learning? And I know that you are working through various learning management systems throughout the state, but we need to know, what is your plan for distance learning? What is your plan for hybrid instruction? And then face-to-face is more explanatory. So really that distance learning and that hybrid model, we need to know what those plans are. Alternate scheduling, staff and student attendance. So how are you going to be tracking staff and student attendance? Transportation planning, meals. And speaking of meals, we have some exciting announcements that we're going to make here in this presentation about meals. What's your plans around personal hygiene and cleaning? And then the communication plans for families and school systems. We're also asking that diagnostics, so LEAP 360 where it's appropriate, and screeners for K-3 literacy, that happens. Those have been provided and are administered to students within the first 30 days of school, either remotely or in person. So to summarize that sentence, basically, kids in grades K-3, we need to do a screener in literacy. And beyond that, those that have access to or where LEAP 360 is applicable, that we're providing that diagnostic. So the reason we're asking systems to complete that, one, we just need to know where our kids are across the state. You know, the governor closed our school buildings in March. We continue to provide some level of instruction, but school as we knew it ended in that day in March. And while we did work beyond that point, and the fact that we missed the standardized testing cycle in the spring, we just really need to know where our students are. We need to know what the impact of this time off has been. And this will be important as we think through a number of policy decisions going forward. But I think it's also going to be important when we might need to make ask of resources. And so having this information will be helpful in those two ways. But also, I mean, guys, the primary reason we assess is to inform our instruction, so our instruction can get better. So if we know where our students are, that would be helpful. The department released a school plan template that can be used by school systems. School systems can also have their plan in an alternate format as long as the required elements are included. As part of the Strong Start implementation survey released by the department, each school system will provide the public web link to their school system reopening plan. School systems and lead agencies must complete the survey by July 28th. So that survey is up and available through July 28th. System plans will be publicly posted no later than August the 11th. So that covers that information for you. Also, we have our network support teams that are in the field. We do not have many employees out on those network support teams. They are a small group of individuals led in the northern half of the state by Dana Talley and the southern half of the state by Joanne Matthews. We're working on making sure that we also have an increased support team for our charter partners as well. But we have turned their work or transitioned their work primarily to supporting with reopening and supporting with COVID. So you'll see those network teams really working over the next few weeks and months on helping support with COVID reopening. But please recognize those are small teams, and we have we have 1,700 schools in the state of Louisiana. So, implementation protocols, registering concerns. So if a community member or stakeholder has a concern about a local system, community concerns regarding school reopening procedures and implementation can be registered with the Department of Education and will be shared with the local school system leadership and board chairs for follow-up. So to summarize that in plain talk, if someone wants to register a complaint against your system, we're going to have a place where they register that concern. We're going to log that concern here, track that, but also shoot back basically an email back to the system leadership and the board chair as well, so that they'll be aware that that complaint came in. LDOE will maintain a public registry of submitted concerns with appropriate data suppression measures in place. And to register those concerns, there again is your email address that can be utilized for that. Food and nutrition waivers. We've had a number of questions about this information. Really pleased to share this out with you. I know the team here in school food service has food nutrition has worked hard to make some of this happen for us. And I'm pleased to be able to share some of this with you today. So we're going to share out a number of waivers here at this time. So the first waiver ends June 30th, 2021, so next summer. And this is around meal service time restrictions. So this waiver allows for flexible meal service times and allows this provision of multiple meals on one day. So just a very practical example would be this would allow a system to possibly serve a Wednesday lunch and a Thursday breakfast at the same time. And you can think through a number of different examples that might make sense, but essentially that's what this will mean. You can see the programs that are allowed in this waiver as well. The next waiver is to allow non-congregate feeding in child nutrition programs. This too will run through June of 2021, next summer. This removes the requirement that meals must be served in a congregate setting and consumed by participants on site. So again, plain talk on this. You don't have to have your meals in the cafeteria. You can have them in the cafeteria, or you don't even have to have them at the school. So the meals can be taken from the school. Individuals can eat these meals away from the school. You can see the programs allowed there as well. Next waiver, nationwide waiver here to allow meal pattern flexibility in child nutrition programs. The effective end date, again, next summer. What this particular waiver means, with justification, meal pattern requirements are waived to allow schools to serve meals that do not contain all meal components. So having served as a local district superintendent, especially during the early stages of COVID response, I know how important this is. And I know that sometimes there could be, issues in terms of supply chains with food. And so if you are able to justify that you were unable to meet all the components of a meal on a particular day, we're going to allow flexibility on that and a waiver of that so that does not become problematic for you during the next year. You have your programs allowed there as well. Okay, parent guardian pickup of meals for children, another waiver, again, ends next summer. And again, I know how this can be of importance to you in local systems. This allows the schools to distribute student meals to the parent or guardian without the school present. If you recall, in the early parts of the spring, when many of us were initially trying to set up our grab-and-go locations or otherwise, one of the questions was, does the parent have to be there with the child in order to get the meal? And so this particular waiver allows systems to distribute that meal to the parent or the guardian without the student being present. You need to make sure that you have a process in place that's documented here. It can't be completely loose. You have to have a process in place and documentation on how you're doing this, and you have your programs where this is allowed. Another waiver deals with high schools, and it's about offer versus serve flexibility. Again, this waiver applies through the year and ends next summer. High schools participating in the National School Lunch Program are not required to use offer versus serve. So if you recall, when high school students go through the line, they can decline a certain portion of their meal. This particular waiver is or will be helpful should you choose to box meals and say take them to a classroom or allow for them to be taken off your campus. It prevents you from having to allow the student to be able to say, I don't want that item. And so you can go ahead and fill that food box with the components that you're preparing for that day and send them and give those to the child without having to allow them to opt out from components of the meal. And you have your programs allowed there. Okay, thank you. Thank you for sitting through that part of the presentation. I appreciate that. Again, I want to remind you that we're all learning as we go. We could have shifts, we could have diagrams on this PowerPoint. We could have places where we need additional clarity, and we just all have to be patient with each other and know that we're working through this together. And we will. And this department may not be able to solve every concern that you may have, but I can assure you we're going to try to do everything that we can do to help you, to make sure that you have the resources and tools that you need and guidance that you need, but also want to encourage you to be working alongside your own counsel, your own legal counsel, specifically around employee issues. So Mr. Bradford, thank you for allowing me to make that presentation, and I think we probably have some questions. And I certainly want to get the most out of Dr. Welch's time with us on the medical side of this while we have him on the call.
Yes, thank you, Dr. Brumley. Yes, we definitely wanted to make the most of our time with Dr. Welch, as he's extremely busy. So we will do that. I'll just address a couple of questions that have come in, and just so we can spend most of our time on the medical side of things with Dr. Welch, and that is the question about securing the PPE from the Office of Homeland Security's, your regional ones. Two things relative to that. Number one, we will post today's PowerPoint deck up on the department's website. We will do that. I'll work with our communications director, Mr. Ted Beasley, this afternoon, and we'll try to have that up this evening. You can go back and refer to the slide on that. We have also embedded that within the FAQs, the most recent one. It's going to be coming out, and so we will embed the securing the PPE through GOSEP in there. So we will address questions relative to securing that PPE through that process. Dr. Welch, I would say overwhelmingly today, the question that has come in the most is about face shields. So can you kick us off today and talk about the use of face shields and what currently our guidance is around those?
Absolutely, Ken. Can you hear me?
Yes, sir.
Excellent, excellent. So I get this question all the time, and unfortunately, face shields are not as effective as cloth face masks. And it kind of makes sense. Most people don't realize that a face shield is actually used in a medical setting to protect the wearer's eyes and doesn't really inhibit airflow with your nose and your mouth. It does allow you to see the nose and the mouth, but really it's intended to protect the eyes. So with coronavirus prevention, you really do need that cloth face mask, which covers the nose and mouth, and that's the way to prevent spreading coronavirus. So unfortunately, a face shield is not equal to a cloth face mask.
Thank you. The next question is relative to the face coverings, and that is a quote unquote break on taking a face covering. You know, talking about is the expectation from when a student gets on the bus early in the morning and then when they get off the bus, is that face mask, other than with the exception of eating, to be on all the time? And how should breaks be considered?
So Ken, I get that one a lot as well. You are allowed to take a break, but what I would recommend to people is you wear that face mask, especially with the new governor's order, when you're in public and when you're around other people. So I want people to wear that face mask as much as possible. If they do need to take a break, what you need to do is step away from people at least 6 feet, temporarily remove the face mask, say you have an itch or need to blow your nose or something like that. You are allowed to step away, take a break, and then return to the situation, but of course with your mask on. It's not it doesn't need to be permanently affixed to your face for the entire time. If you have the opportunity to step outdoors or step to a place where no other people are, it's perfectly fine to remove your mask and take a break.
Thank you. Several questions also came in about the partitions, and we've answered this before. We actually put it in our FAQ. So what I'll do, Dr. Welch, is since there were so many questions today about the partitions, I will read the current guidance that we had previously generated and shared in our FAQ, and then ask you to provide comment and context to that. We have our partitions required for multiple static groups within a large indoor area, such as a cafeteria or perhaps even a large library. Our response has been, yes, partitions should be used between static groups in large indoor areas. Partitions must be at least 6 feet high. Hanging dividers are acceptable as long as they meet all other safety regulations.
Ken, can I make a clarification to my mask?
Yes.
I did get a question and have received multiple questions before. There are some circumstances and some indications where you really do need to see a person's mouth, and there are now clear face masks that have a cloth border, but then have a middle face clear plastic, and those are acceptable as long as it does cover your nose and your mouth, and the border is cloth or medical grade material. So that those are acceptable, so you can see someone speaking, but their mouth and nose are still covered.
And back to the question on the partitions, can you just provide context on the partitions for if they're like using a gymnasium? And we have put in guidance before and spoke to the 6 feet like walls or hanging dividers as long as they are safe.
Yeah, absolutely. And that's the intent, is really to maintain that static grouping. It is difficult to maintain static grouping if you have so many people in one room and you don't know who's in what group or not. So really having those physical barriers between groups helps us maintain those static groupings. And remember, the whole intent of that, Secretary Brumley inferred that there may be some situations where some students or instructors need to be quarantined, or even possibly a class. The way we make sure that those impacts are minimized is by following these rules. I'm working with Secretary Brumley and Secretary Phillips right now on a list of common scenarios that we're going to share with everybody, but they all are in, the result of all the scenarios is, were these people 6 feet apart? Did they maintain their static grouping? And were they separate from other people? And the answer to who gets quarantined and who has to, stay home are dependent on some of those answers as well. So I really want to stress to you all, rather than trying to see how you can get around these recommendations or minimize the impact, try and effectively do them, so that if there are cases, just as Secretary Brumley said, there are going to be cases in your schools. And in order to minimize the impact of those cases, really try and follow these rules to the best you can, including using those partitions between static groups.
Thank you. I'll ask the next question for Dr. Brumley, and this is, I think you clarified this today on the call, but the requirements that were adopted by the Board of Elementary and Secondary Education for the approved non-public schools, the charter schools, and the public school systems, do they have to have these adopted as local policies?
Yes, Act 9 required that every system, after Bessie set the minimum standards, that every system then in turn has to adopt policies that make sure that that local system is aligned with the Bessie minimum standards that have been set. But Ken, I want to make sure that I don't overstep here, and also encourage all local systems to make sure that they're having these particular conversations with their legal counsel to make sure that the policies that they adopt are the right policies and that they fit the needs of their particular system.
Yeah. And the other question for you, Dr. Brumley, that has come in is are school systems required to offer a specific delivery method in each phase, such as virtual, hybrid, or face-to-face? Or is this something that locals can determine based on what's best for their unique needs?
No, we haven't indicated a specific program that must be purchased or bought or utilized. We've just said every system needs to make sure that they have a fully online model for every family that chooses that, but also in the event that we did have to go fully virtual, that we would be able to have every child go fully virtual. And I understand there are concerns around even connectivity still and supply chain on devices. I get all of that, but we need to make sure every system has that in place where they do have this program available. Hybrid may or may not even include a technology, a full technology component. It might be that you have an A-day, B-day schedule, or it might mean that you're bringing in your elementary kids, say, every day of the week, and so they have no fully virtual. I mean, they have no virtual component. But if you're bringing in all of your elementary kids, it might mean that your high school kids are fully virtual. So we have not specified any particular program or how to do this, only that everyone needs to have a fully virtual model available, a hybrid model, and then, of course, the regular traditional model of schooling.
Thank you. Dr. Welch, the next question is relative to the static groups, and we've had a few questions coming in about the, quote, breaking of a static group, meaning what things should be considered if you have a teacher, 24 students, and then at some point, a student, perhaps the students with disabilities, there needs to be a speech therapist may need to come in, or an occupational therapist for that specific student. What considerations should be made for the static group, knowing that there may need to be, the entry of an individual into that static group to help them with their specific disability?
Yeah, and again, Ken, what our guidance is just recommendations based on the best you can do. Again, the greatest extent possible. What the static group is intended to do is limit the number of interaction that each person or child has per day. And again, that's because if and when we do get a case of coronavirus, there is going to be recommendations for people to stay home. And if they were exposed to coronavirus, call their doctor and watch for symptoms. By limiting the number of interactions we have between people every single day, we limit the number of people who are exposed to coronavirus and limit disruption to the school. So I would certainly suggest that if your static group had to have someone step out or someone else step in, you try and minimize that, make sure that both the people are wearing masks, make sure that they're wearing that they're washing their hands and trying to stay 6 feet apart from each other. Again, that 25 is sort of the maximum we want in a static group. Do the best you can, but again, what we're trying to do is minimize interaction, personal interaction between people by limiting the number of people so that if and when something bad happens, we minimize disruption to the school.
Thank you. I think what else would be helpful, Dr. Welch, and I've heard you do this many times, and it's a really good explanation for folks. And we have over 800 people at one point today on the call, so there may be some that haven't heard all of our presentations and webinars. And that would be if you could share for them, kind of a visual. What might the static group of 25 look like for, let's say, a group of first graders? And then also talk about the physical and social distancing what that might look like on a high school campus for those students in 10th grade that change classes and go from geometry to English 2. So kind of sharing that high school model versus the lower grade elementary model.
Right. So I know I have shared this with all of you before, but sort of the gold standard, the ideal thing really is to have people stay 6 feet apart from each other. Coronavirus is obviously a virus, but it's spread on little water droplets. The virus doesn't just float freely on its own. So by staying 6 feet apart, and that's why a cloth face mask works as well. You can imagine just, and the recommendation is t-shirt quality, doubled up. So that isn't even a very thick or heavy face mask at all, but it does stop those water droplets that the virus is in from going to other people. By staying 6 feet away, washing our hands, and wearing that face mask, we really do significantly prevent coronavirus. As Secretary Brumley said, CDC came out yesterday, and that if everyone wore a face mask for 4 to 6 weeks, we could almost completely control coronavirus. So just knowing that, though, we know that those younger age groups, you know, say a first graders or even kindergartners, are not able to maintain that 6 foot distance. So we still want them to do all those things. Try, like when they're seated or sleeping or nap time, to stay 6 feet apart. We want them to wash their hands. We want the adults to wear masks, but we don't have the expectation that 25 kindergartners can social distance. And that's why the limiting of the group size. If they come into contact with less people per day, it's less likely that coronavirus is going to be introduced into that situation. But if coronavirus is introduced into that situation, we limit the number of people who are impacted and possibly having to quarantine at home. In difference, that is, say, a high schooler who has to change classes, interacts with dozens, if not more students every single day, multiple teachers. We really do want those older students who can wear a mask and who can social distance to do so, because again, that's the gold standard. By staying 6 feet apart from each other, by wearing your mask, frequent hand washing, again, that's going to minimize the impact of coronavirus spread within the school, but it's also going to minimize the number of contacts that the Office of Public Health identifies that may have to quarantine from that student. There was a MMWR, and that's a medical publication that comes out every other week. And they described a scenario that happened, fortunately not in Louisiana, about 6 weeks ago, of 2 hairdressers during phase 2 in another state, again, who both had mild cold symptoms, went back to work, and over the course of 3 days interacted with 138 clients. And because both clients and the hairdressers were wearing masks the entire time, not a single client was infected with coronavirus. So I just really want to stress to people, masks really, as Secretary Brumley said, masks really do work.
Thank you. I'll answer the next one, and then we'll maybe have time for 1 or 2 more for you, Dr. West. The next one is we've been asked by folks, where can they see the actual policy? And so what we will do is we will ensure that we get links to the actual policy that was approved by the BESI board earlier this week. We will put those in our FAQs. Those documents are also available on the Board of Elementary and Secondary Education BESI website. You can go there and they have a link for the meetings, and you can pull down the meeting that was held on the 14th, and you can view those documents there. But we'll also add links to those in our FAQs. Dr. Welch, maybe we have time for 2 more, and so if I were to touch on 2 more, I would say I'll bucket those into locker rooms and restrooms. One, how can locker rooms, what consideration should be taken for locker room utilization, and then how often should restrooms be cleaned?
Excellent. Both excellent questions. So locker rooms, we really do need to treat those just as if they are a school classroom, maintaining that physical distance between people. There was an original recommendation quite some time ago, do we close locker rooms? But absolutely not. We do want those available also. You can imagine that those would be a great place to wash your hands as well. So we do want people, if you are in the locker room, to maintain physical distance, to wear a mask. but also to wash your hands, and then those frequently touched surfaces within a locker room, treat them just like a bathroom, and really clean those every other hour. Those would include the door handles, the faucet handles, anywhere that's a frequently touched surface. And then I think, Ken, your second question dealt with bathroom cleaning, how often? And I think our guidance currently says frequently. That's going to depend on your available cleaning staff, but we really do want, and when we say cleaning the bathroom, I think most of the time when we think about cleaning the bathroom, we think about toilets and floors and things like that. What you really want to focus on, especially in the bathroom, every other hour, say, is cleaning those frequently touched surfaces. The door handles, the faucet taps, if there's something physical you have to touch to dry your hands, you really want to clean those surfaces that students or teachers are going to touch frequently.
Thank you. We'll end on this one, Dr. Welch, and that is water fountains that are in school systems. What consideration should be taken relative to the utilization of water fountains?
And Ken, I think we have some guidance. I don't remember what page this is on, but the water fountains where a student would have to go and actually physically touch the fountain and actually lean down and put their mouth down to drink water, those should be closed for obvious reasons. You know, if someone with coronavirus went to one of those water fountains, that would be a really effective way to spread coronavirus. However, many systems in schools have bottle fillers. And what I have recommended in that, if a student doesn't have their own container to fill up the bottle, that one of those little paper cups, disposable single-use cups be used, but you can use those bottle filler ones. Those are perfectly safe. You don't really touch anything. You just touch your own bottle or your own cup, fill it up, and it can be used that way.
Yep. Thank you, Dr. Welch. You're correct. That's actually on page 10 of our school reopening guidelines and resources, which is can be found on the department's website, homepage of the department's website. We're up on time. We've answered the vast majority of the questions. I was able to group those like questions. I would just say that if you have an outstanding question or you'd like some more specificity, you should email us at our LDOE COVID-19 support email account. You can find information about that email address on our department's website. But please submit us an email request, and we will respond to that. With that, Dr. Welch, I would like to thank you for joining us once again. And if Dr. Brumley's on the line, I'll let you give closing remarks.
Thank you, Mr. Bradford. I too would like to echo the thankfulness to Dr. Welch. You're just great, Dr. Welch, and we appreciate all the help that you give us, and we're thankful for you being a part of our team, and we know that you'll continue to work with us to help answer questions that systems have, and including some of the primary situations we expect them to run up against. To all of the educators on the line, thank you for what you do. We have a challenging year ahead, but I believe in us. I believe we can get this done. I believe we'll find a way. And I hope that I can stay positive and upbeat about everything that we have to do. And if you see me not that way, call me out and tell me to put a smile on my face, because I've got to help us all get through this. But along with that, I ask that you do the same, because we're going to be setting the tone in our local communities, in our schools, and our systems. And so I know that we can do this together, and I'm glad to be partnering with you for this. Thanks, Mr. Bradford.
All right. Thank you, Dr. Brumley. And just in closing, I'd encourage folks to please continue to go to the department's website and read our reopening FAQ document. We update these frequently during the week. Every time they're updated in bold red font, we provide you with the date that they were updated. Second is today's PowerPoint presentation. I'll work with Mr. Ted Beasley, our communications director. We'll try to get this posted this evening up to the website. And then we have recorded today's video Zoom session. We'll pull this down, and then we will also publish this to the website. Realistically, this will probably be published sometime tomorrow, today's recording. So again, thanks everyone for joining us. Have a good afternoon.